Welcome to my lecture on writing up qualitative research. My name is Priscilla Magrath, and I work at the Mel and Enid Zuckerman College of Public Health at the University of Arizona. Today, I'm going to be talking about the challenges of getting from analyzing your qualitative data to publication. And the first thing we're going to talk about is the challenge of qualitative data analysis and how you convince the reader of the reliability and validity of your data. We're going to talk about what you need to consider, including the audience, the journal, and any clients you may be doing research for. We will talk about audit trails, pathways to getting from analysis to publication, and the use of theory, including discourse analysis and narrative analysis. So let's get started. This is a broad overview of the phases of research: developing a research question, collecting data, analyzing data, and writing up. For qualitative research, we typically use an iterative approach, where at any stage we may return to the previous stages. So when you are analyzing data, you may realize that you need to collect more data, or you may modify or add to your research questions. The challenge for qualitative data analysis is that with qualitative data, we are analyzing words. With quantitative data, the analysis of numbers, there are already established statistical methods, including the measurement of error. With qualitative data analysis, this is based on interpretation, and different people may come up with different interpretations. And so one of the biggest challenges is how to convince the reader that our analysis is not just our opinion. You may already have experience, as I have, of people saying, but this is just anecdotal. This is subjective. What am I supposed to do with this, these findings or these results? The concepts of reliability and validity are applicable to qualitative research, not only quantitative research. So reliability means that another researcher using the same methods would come to the same conclusion. Whereas validity means that your findings represent the reality, what is actually happening in the world. And so in this talk, I'm going to talk about ways that you can make your qualitative research more reliable and improve the validity. So the first step is an audit trail. Some people may call this keeping memos, keeping a journal, but the important thing is to keep a record of everything that you do right from the beginning of the research process, the decisions you took and why you took them. And secondly, very important, what you are thinking, your reflections, your ideas, your interpretations, what seems to be important, what is going on here. During your data collection, somebody may say something that takes you by surprise and sets you thinking, maybe this concept is important, maybe I need to think about my research in a different way. When I was doing my doctoral research in West Java Indonesia, I intended to study the decentralization of health services. One idea that emerged during the research was the concept of the right to health and how people talked about the right to health. But that wasn't in my original proposal. So I kept notes and wrote a monthly report. And in my notes, I said, the right to health seems to be important here. It's something that people take seriously and health workers talk about it. Perhaps I should include it in my research. So I want to emphasize that it's not only what you did, but also how your thinking evolves. And so there are two main advantages of keeping an audit trail. The first one is transparency, so that you inform others what you did. And some elements of your audit trail may even end up in your methods section of your journal article. This is particularly important if you're doing teamwork, because every team member needs to record why they did what they did. Otherwise, you get a situation of, to use an English expression, too many cooks spoil the broth. People start doing things without recording. They may end up undermining what other team members are doing. The other advantage is that the quality of your research improves because it encourages you to reflect on the process. So with qualitative research, it's especially important that what is of value is not only your findings or your conclusions, but also the process, how you got to those conclusions. That will improve the reliability because others will be able to repeat what you did, and it will also improve the validity because you are constantly reflecting and checking on what you're doing. So the second step is to identify your audience. I have encountered some people, I remember a doctor in Indonesia who said, just give me numbers. I'm not interested in words and stories. I just need your numbers. So some audiences are skeptical, and we need to work harder to convince them that our qualitative research is valuable and useful and important. So one question you might ask is, do I want to speak to a public health audience or a medical audience or a social science audience? So if you're talking to a public health audience, that people are often interested in interventions, in the application, in what they can do with the results. Whereas in social science, they may be more interested in the theory or the conceptual framework, or they may want to know what theories you have been using in trying to interpret your data. So you may write up your work very differently for a public health journal compared with a social science journal. You may have noticed that public health journals have a smaller word count, shorter articles, maybe 4,000 words, and a social science journal, such as Social Science and Medicine or Qualitative Health Research, they might have an 8,000 word count. Another thing to think about for the journal is it more focused on research or implementation? Is the journal linked to a particular organization? Does it have specific objectives? And what is the attitude towards qualitative research? You can find this information by going to the website of the journal and also by looking at example articles from the journal. So if you read 10 articles and none of them mention qualitative research, that may not be the journal for you. So what I found very useful, and I can also acknowledge my colleague and friend, Rebecca Crocker, also a medical anthropologist. She and I have developed this table of journal articles. And so let's go through that one by one. So we've got the names of the journals in the first column. And the first column here is focus and audience. So here, for example, if we see the Global Health Promotion Journal, we learn from the website that this is the official publication of the International Union for Health Promotion and Education, okay? And if you look at their articles, they accept qualitative and quantitative. So that's the second column here is the style. The third one is the page limit. You should think about that very early on. There's no point in writing 10,000 words and then finding you can only publish 3,000 words. And it takes a long time to cut down the word count. And then you may want to have the impact factor of the journal. So if we take another example, Health Promotion International, this is the journal of the International Health Promotion Movement. And they actually say on their website, they're looking for clear messages on how to improve health promotion. So this is the sort of information you need to know. The earlier, the better, really. You need to start thinking early. So in my table, I also include some social science journals as well. And I use a different color for those because I know that they're going to need a very different kind of approach when I'm writing up. So you can modify this and add columns. You might want to add a column for submission status, you know, if you've submitted an article or not. Open access, whether this is an open access journal, whether they accept, whether they will charge you for open access. If you don't have a budget for open access, you might want to avoid an article that, a journal that requires an open access fee. So the third thing that I wanted to talk about is that there are several standards for reporting qualitative research. And again, the earlier you look at these, the better. They are increasingly required by many journals, and it's very useful to review these early, even as soon as when you're designing the research, and it will help to frame your article when writing up. So one example of this is the Standards for Reporting Qualitative Research, a synthesis of recommendations by these authors, written in 2014 and published in Academic Medicine 89/9. Now, this is the one that is actually required by the journal Health, Education and Behavior, and probably many other journals now. So you can look that up on the internet. So what I've got here is selected headings. The standards for reporting qualitative research includes the entire structure of your journal article, including the abstract, the background, and so on. I've taken some headings from the methodology section only, and it is very thorough. It requires a lot of detail. So again, think back to your audit trail, and if you've kept a good audit trail, it's going to be very easy to write this up. So the first heading is Qualitative Approach. Is this an ethnography? Is this grounded theory? Did you use interviews? Did you use focus groups? Then we have researcher characteristics, and this includes reflection on your positionality. How do your personal characteristics relate to those of your participants in terms of maybe age, ethnicity, gender, and so on? And how did you address those things, and any trainings you might have done with people collecting data and so on? Your sampling strategy, ethical issues, and data collection methods. So I'm going to assume for this talk that you've already done your data collection, and I'm going to be focusing mostly on the items that are highlighted in green here: the qualitative approach, data processing, which is your coding, data analysis, your interpretation, and techniques to enhance trustworthiness. That is actually in the standards for reporting. So did you use an audit trail? Did you test for intercoder agreement among different coders? And triangulation, which means comparing results from different components or different data collection methods. So let's move on and focus on those green ones: data processing and analysis. Now, the data processing, again, can be broken down into distinct steps or components. And the first one is data reduction. And it's really important to remember when you're doing your data analysis that the goal is to reduce. In qualitative research, we often collect vast amounts of data from interviews and focus groups, and it can be very overwhelming. And I think one of the biggest issues with qualitative research is data is collected and it is not analyzed. I often have colleagues coming to me saying, we did these focus groups and we didn't have time to analyze them. Are you interested? Well, my philosophy is that I like to analyze data that I have personally been involved in collecting. So I'm not usually very enthusiastic about that prospect, but it's just a reflection of the fact that when you do your qualitative research, you need to plan for the very time-consuming process of reducing that data to something manageable, something accessible. And that is the data reduction. And the second stage that is very, very important, but sometimes missed out, is data displays. So qualitative research, especially for social science journals, sometimes consists of pages and pages and pages of text and occasionally a quotation. So what is very strongly encouraged, if you want your qualitative data to be accessible, is to summarize it in diagrams of different types. So we'll talk about that a little bit. And then we have drawing conclusions and verification. Again, we come here back to the idea of reliability and validity, that you always need to be testing your conclusions, going back to your data and making sure that your conclusion is robust and you have evidence. And I've taken this simple three-part process from Miles and Huberman, writing in 1984, that book, Qualitative Data Analysis, by Sage Publications. Now, this has probably been updated, but it is interesting to note that methodological texts don't really go out of date. And sometimes it's an advantage to read a text that was written before the software programs became available, because sometimes if the software can do things for you, you forget that it's important for you to go through the process and to understand the conceptual steps, because it's too easy in the software just to press a button. So we'll start with the first step, which is data reduction. I'm not going to spend a lot of time on this because I want to focus on the later stages. But the main goal in your data reduction is to find patterns in the data. And the common way to do this with qualitative data is through identifying themes, which are then become codes, building a code book, and coding the data. And as I say, I'm not going to spend a lot of time on that, but data reduction can be aided by increasing number of software programs, and these provide very detailed instructions on what is a theme and how to code and how to build your code book. So in my qualitative methods class, we use MaxQDA, and other programs include Deduce and Vivo and many other programs. So moving on to data displays, you can use charts, matrices, flow diagrams, decision trees, and these can be useful at different stages. So one stage would be when you're trying to conceptualize your research. So a doctoral student in the college is doing research on vaccination attitudes, and she has been using the increasing vaccination model developed by the World Health Organization, but you can adapt this idea to your own research. And in this case, it's just representing your research questions or your data in a visual way to summarize it and simplify it. So this is just one example. You can, and this is a flow diagram that moves from the left, what people think, and then the social processes feed into your motivation, whether to get vaccinated or not. And then even if you're motivated, there may be practical issues that intervene, and then you end up with whether you get vaccinated or not. So the other, so this is sort of probably at the early stages of analysis that you would use a conceptual model to understand what's going on in your data. And then another very important reason for data displays is to summarize your findings. And I want to talk a little bit about framework analysis, which is a sort of early stage in analysis that can be very useful for summarizing your data. And it's basically a way of charting coded data to identify patterns, both across cases, that means across all your interviews or across all your focus groups, but also within cases. And this is useful for two reasons, really. One is identifying codes that need more in-depth analysis, and secondly, presenting a summary of your data. So I made up an example using some research that I've been doing with my students have been doing in my qualitative methods class this semester. And this is a study interviewing older adults on their perceptions of what it means to age well. So in a framework analysis, and I'm not saying these are the themes we actually came up with or what the participants actually said. This is just for illustration. So one way to do a framework analysis is you put your themes on the first column on the left, and then each participant, that means each interview, is in a column to the right. So just as an example, one of the things that came up in the interviews was people talking about life transitions, perhaps when they changed career or retired or started volunteering or something like that. And so you would put the theme in the left-hand column and then a summary of what participant one said. What was the essence? Now, again, we're talking about a process of data reduction. So don't think, oh, I've got to be really, I mustn't misrepresent this person. I'm going to give the full quotation of a whole paragraph. That's not going to be as useful in a framework analysis as just saying something like, participants one talked about the need to accept your limitations as you go through the transitions of life. And other participants said they were not afraid of death. Maybe they had a whole paragraph talking about, why they weren't afraid of death and what the implications are. But for your framework analysis, less is more useful, to have it as short as possible, so that I think you can see the benefit in one glance, you can have an idea of, what participants said in essence. If you read across, you can see, okay, what did people say about transitions? Oh, look, that's quite a lot of variation in what they said. They didn't all say the same thing. On the other hand, you might want to say, well, what did participant 1 say about all of the themes? Can we get a kind of coherent idea of who this person is with this very, very brief information? So some of the other themes were the importance of helping others, and this participant talked about that in relation to volunteering. Maybe she gave a whole story about he or she about how they decided to volunteer, but I've just put in one word, volunteer, helping others. For this person, it's all about volunteering. Keeping busy. This participant gave an example, cooking for their neighbor. So whatever you think is a good summary of the data, you put it in your framework analysis. Now, again, let's return to why it's useful. You could do this if I have used this framework analysis for client research in public health. This may be sufficient. You may not even need to do your detailed codebook and analysis and software analysis and all that sort of thing. You may just be able to present the framework analysis and then write a report based on the framework analysis. Because in public health, sometimes all we want to know is the summary, the essence, and then we can move on and design our program or design our policy, and that's enough. Another example where I've used framework analysis, one of my MPH students, Masters in Public Health, for her internship, she used the framework analysis. And one of the things that became obvious is, well, this is not going to be sufficient. We need much more in-depth analysis because the issues we're talking about, in this case, it was about early language development of bilingual children living in a border town. And so some of the concepts that came out will need much more in-depth analysis. In that case, the framework analysis is the first stage that helps you to identify where you need to do more in-depth analysis. Another, it is possible also that you would include your framework analysis or a summary of it in a journal article or in a presentation, if you wanted to give feedback to the participants, for example. And then you want something, a simple table like this, and it may be a good way. Of course, if you have a lot of one study that we did for maternal and child needs assessment for the state of Arizona, we had about 50 focus groups or something. So then you can't really summarize it in one simple page. But it was a very useful approach nevertheless. So the final stage, when you've done your data reduction and you've done your data displays, you will want to come to some conclusions. So what kind of conclusions are you looking for? Well, I've got 3 questions posed here. So again, we're looking at text data, we're looking at what people said. So are we interested in what they said? Is that going to be enough? That would be a content analysis. And again, in public health, that is often enough. The purpose of the study may be to give voice to groups that are traditionally not heard, just to hear what they say. This was the case with the Title V Maternal and Child Health Needs Assessment that we did. We were asked specifically to give voice to voices not traditionally heard, and we did focus groups with LGBTQ+ community, children, families of children with special healthcare needs, African Americans, farm workers, Latinos, all kinds of different groups in Arizona. And really, we were just interested in hearing their voices, what they had to say about maternal and child health services. So a content analysis would be enough. If you're writing for a social science journal, you may want to delve deeper and draw on social theories and so on and so forth. So a simple way is to ask the question, well, what did they say isn't enough for me? I'm interested in why did they say it? You know, what is it about the situation they're living in that makes it possible for them to make these statements? What is the context? And so discourse analysis is very useful for that. If you want to delve more deeply into the cultural context and answer the question, well, why did they say that? A third question that you could pose is, well, how did they say it? How do people tell stories? And that would be narrative analysis. So I'm not going to talk about content analysis because I think it's fairly straightforward. That would involve doing your coding, building a code book, and then presenting the results, perhaps in a framework analysis or something like that. So what about discourse analysis? Again, this is a term that may be a little bit intimidating, and it means different things in different disciplines. If a linguist talks about discourse, it may have a different meaning from if an anthropologist talks about discourse, or a historian, or a political scientist. So let's try and keep this simple. And there are two aspects to discourse analysis that I want to talk about. And the first one is to recognize that when people speak, they don't include a lot of background information that they assume everyone knows, okay? That is called tacit knowledge, or even it could be subconscious. And discourse analysis, you want to bring that to the fore. You want to make it explicit. And so that's a process of linking statements to the cultural context, or maybe the historical, or the political, or the economic, or the social context. So there you're sort of asking, well, how does this statement link with political debates that are going on at the moment? Or, for example, with the vaccine research, if somebody says, well, I don't know what I'm putting into my body, so I'm not going to get the COVID-19 vaccine. I'm not sure about it. There hasn't been enough research yet. We can all recognize in those statements debates that are going on in social media and politicization of the issue. And so even without doing an in-depth discourse analysis, when we read those statements, we're probably making some connections in our minds. Oh, that's one of those people who is a vaccine hesitant, or that's a COVID denier, and so on. We're making all those connections. So to do that in a more systematic and formal way is discourse analysis, linking your analysis to the cultural context. The other important aspect of discourse analysis is to recognize that when people speak, it is a social performance. They are not simply conveying factual information, but there are other intentions and effects. So when you'll probably notice, if you look at your interviews, for example, the interviews on what it means to age well, people are using this opportunity to talk about their views on aging well to demonstrate their moral values. We already saw in the framework analysis the idea of helping others. If somebody talks about aging well means helping others, they are also making a statement. I am a good person because I help others. That's demonstrating their moral values, their moral identity through their speech act. Speech acts could also be used to justify actions. In our textbook, there was the example of somebody who called the ambulance, the emergency number, for their asthma. And then they had to justify it. They felt the need to justify it, saying, I didn't feel very ill, but I was following the doctor's recommendation that if I need to use my asthma puffer twice, then I should call the ambulance. But I felt bad about it because I didn't feel sick, but I did it anyway. So that's justifying actions. You might want to blame others. For example, if somebody tested positive for a stigmatized disease such as HIV/AIDS, when they talk about it, they may want to say, you know, it wasn't my fault. It was the will of God, or you know, it was my partner, or something like that. So discourse analysis will be trying to identify what these speech acts are trying to achieve. Another one that is quite subtle but very important is creating common ground with the audience, or just trying to show that you understand the situation. So there are a lot of social cues going on in a focus group, for example, the way that a certain speaker may become more dominant, and how do other people react to that? Do they accept the dominance of one speaker because they have a higher status, perhaps? When I was in Indonesia doing focus group with community health workers, in one group, the wife of the village head was one of the members of the focus group, and so she tended to take the lead, and the others, through their body language and through their speech acts, recognized the status of the wife of the village head through their statements, perhaps by agreeing with what she said, or certainly not wanting to contradict anything that she says. So you're trying to create that common ground with the audience, that a common understanding. Common ground could include a common understanding of everybody's relative social status, or it could include perhaps trying to identify whether the audience shares the same position or a political position on an issue or something like that. And then you could use speech acts to impress or flatter somebody. So those are the intentions. Now, the effects may not be exactly what you wanted, but it's important in discourse analysis also to recognize the effects. And this may be more evident in a focus group. For example, sometimes in a focus group, you may find that somebody raises an issue, and then another person in the focus group is dismissive or negative about that issue, and then the person will just keep quiet after that and won't say anything again, because for fear of being silenced again. So when you're analyzing the data, you need to try to pick up those cues about who is talking. So an example of that, there was some research done in the UK about families and attitudes towards parenthood. And somebody mentioned something about, well, parents could include people who are on the LGBTQ+ spectrum, maybe somebody who's homosexual or whatever, and then somebody else sort of cut that statement off, and so there was never any more discussion of that issue about those kind of less common forms of parenthood. So when I was looking at the data from the Aging Well study, we sort of asked this question, well, one way of understanding what people think about aging well is to ask, well, what would aging badly look like? Or what would be an example of not aging well? Again, this is not a direct quotation, but a paraphrase of what one of the people said. Well, the worst thing you could do is give up, or you mustn't give up, because that would be kind of that would be the end, really. So they were talking about how you have to keep busy and helping people, and you mustn't give up. So I am not originally from the US, I'm from the UK, so I have a little bit slightly different cultural lens. So if I were doing a discourse analysis, then I would sort of think, well, why is giving up considered to be such a bad thing in the US? And then I would think, well, maybe it's related to US culture. And there's a very strong, I find, there's a very strong work ethic in the US culture. You know, there's an idea that one should be productive all the time, and production is very highly valued, and doing nothing is correspondingly not highly valued. You could contrast, you could sort of say, well, isn't that the same everywhere? We live in a capitalist world. Well, I think in some Asian cultures, there is an idea. I mean, if you think of the Confucian value system of yin and yang, the concept of yin includes being reflective, and even being passive is part of the yin, whereas the yang is more about being proactive and being active. So there's an idea in that culture that you need a balance between doing and being. But this statement, you know, the worst thing you can do is to give up. You could follow a line of argument that is related to a work ethic in the US culture. And then you could perhaps link it to theory. So there's a lot of social science theory about neoliberalism as emerging since the 1980s, with an idea that the market logic is the most efficient way to do things. And so even things that had not previously been done like a business, such as government or the family or churches, start to be run like businesses, even to the individual level. So within social science theory about neoliberalism, there's this idea that every individual, it must be an entrepreneur of the self. You must be always being entrepreneurial and creative and innovative and working and everything. And so you can see that that is the complete obvious opposite of the idea of giving up. I'm just giving you an example. I'm not saying this is the correct way to do it or a good way to do it. I'm just saying this is the kind of thing you might do with discourse analysis, linking what people say to the culture, to theory, and then also you could say that this person who said the worst thing you can do is to give up is making a moral statement. I am not somebody who will give up easily, which again is a very strong value in the US, that you have to keep trying. And, you know, if at first you don't succeed, try again. That is a saying that I grew up with anyway. And you can see that this whole thing about being an entrepreneur of the self, not giving up, is also compatible with an individualistic culture, an idea of individual responsibility for the self, that may not be so applicable if you were in a culture that was much more group oriented, where maybe it wouldn't be entirely up to you to, you know, be an entrepreneur, or alternatively to give up. Because in some cultures, and this was my impression in Indonesia, that pretty much everything you do with other people. And so in a way, the responsibility is shared for what you do. I remember in Indonesia, the school children, I would watch the school children come out of school, and they would be doing everything together. They would walk home together, they would do their homework together. They would, you know, nobody would ever do things completely on their own if they had the choice. You know, there always seemed to be preferable to be doing things in a group, which is not so much the case in the US. So that is just an example of discourse analysis. Now let's move on to narrative analysis. Now the word narrative means stories, or about stories, or the way people tell stories. And again, there are many ways of doing narrative analysis, but just for simplicity and just as an illustration, narrative analysis might want to focus on the structure of stories. How do people tell stories in this culture or in this situation? Now, in the health sciences, there is increasing interest in illness narratives, how people talk about a chronic illness and maybe their health seeking in relation to that illness. And so you might want to look at the structure of stories, but also you may want to look at the function of stories. Why do people tell stories? How is it helpful for the individual or for the group? And a third option would be to analyze what stories reveal. And then we're really going back to discourse analysis of stories. It's like when we read this story, you know, maybe again, it's a story about vaccine hesitancy, then we may want to do a discourse analysis of the story. So let's spend just a little bit of time on those. The structure of stories, I've taken this from our textbook. The original source is Labov and Waletsky, suggested that most stories that people tell include these elements. So this is, again, it's a little bit like a theatrical performance or something that usually has a cast of actors, and then you'll have scene 1, scene 2, scene 3, and so on. So they've suggested that when people tell stories, subconsciously or consciously, they divide it into these sections. So first of all, there'll be the abstract, which would be something like, oh, did I ever tell you the story about how I, in the textbook, it gives the example, how I was misdiagnosed with irritable bowel syndrome when actually I had celiac disease or something. So the abstract summarizes it. And then the background information, well, you know, I was getting sicker and sicker, and then, you know, my partner was getting really worried, but I went to all these doctors and they didn't know what was wrong with me. So that's the background information. Then we have the complicating action. You know, we arranged to go on holiday and I told my partner I was just too tired, and he said, this is ridiculous, we've got to find another doctor. So that's the complicating action, sort of builds up the tension and creates a sort of a social crisis in a way. And then the story moves on to the resolution, where the tension is released. You know, finally, I managed to see a doctor who correctly diagnosed me with celiac disease, and then I was able to get the right treatment. And then you get an evaluation, which is the moral of the story. In this case, in the textbook, it said, well, the moral of the story is you should always get a second opinion on your medical condition. And then there'll be some kind of conclusion at the end. So this is one structure, and there's been a lot of debate about whether all stories need to fall into this, and perhaps there is cultural variation in how stories are told and what are considered to be important elements. I find this interesting because an anthropologist called Victor Turner developed the idea of a social event or social drama, which was very similar in the sense of he described from his ethnographic work about how social dramas evolve and how the tension builds up and then how it gets resolved, and maybe it could, again, it's a sort of cyclical thing, and then, you know, another social drama builds up. So you may or may not be interested in the structure of stories. That's one way of analyzing stories, but not the only way. So I think in medical sciences, the functions of stories may be more important, particularly if you're interested in mental health or how people make sense of illness, because one of the main functions of stories is making sense of our experience in the present. So stories are historical in use. So, but they're not simply factual expression of what happened in the past. The way that we interpret the past is effective in different ways in the present moment. So I think illness, chronic illness, is a very good illustration of this, that if you experience a diagnosis, for example, that is described in the literature as a biographical disruption. For example, if you get a diagnosis of cancer, it may change the whole way you think about your past, your life, your future, what life is all about, a reassessment of all your past experience, what might have led to the cancer, what did I do in the past, things that I thought were good or maybe turn out to be bad. I mean, another example would be tobacco. If you are a lifelong smoker and then your doctor tells you a diagnosis that is caused by smoking, you may reevaluate your past, where you may have viewed smoking as a social facilitator and maybe an important part of your social life, and then you start to think, well, maybe I also need to view it more in terms of how it has been affecting my health. So another colleague of mine did her doctoral research on chronic pain and the use of traditional Chinese medicine to address chronic pain. And so she did longitudinal research where she interviewed people at 6-month interviews. And one of the things she was looking for was how their stories might evolve in relation to the effectiveness or otherwise of the traditional Chinese medicine. So the way people talk about their chronic conditions may evolve over time in efforts to make sense of new experiences, in efforts to make sense of treatments, for example, or therapies. So that's a very important way that stories can be used. Now, again, it depends on your data collection method, whether you get stories, but I would encourage you, even if you're in a focus group and somebody says something, quite a brief statement, it could be interpreted at least as a fragment of a narrative. So if somebody makes a statement, so I think in one of our research projects, a student said something like, at that time I had so little money and I didn't have enough money to eat properly and I was starving myself. That is a fragment of a narrative that you could relate to that student's life experience. And so again, you could do some kind of narrative analysis, even if you just have a fragment of a story. So let's move on to the conclusions. I'm not going to talk about grounded theory because that relates more to your coding method. And I wanted to focus on the analysis in this particular talk. So moving on to conclusions, what I wanted to emphasize, one of the challenges of qualitative research is that people say, well, you only interviewed 30 people or you only interviewed 10 people, so we can't possibly generalize. So they're trying to tell you that your data is useless. So again, there are different ways of generalizing. You may not be able to generalize the exact content, but especially if you've done a good discourse analysis or a good narrative analysis, what you may be able to generalize is the concept or the insight. Or you maybe what you can get from your study is a sort of limiting case of knowing what is possible. So an example of that would be in our maternal and child health study. We've been interviewing mothers about their experience with prenatal and childbirth care. And so one mother said in our study said something like, the nurse just left me and my blood pressure was all over the place and I really thought I was going to die. Okay, so that's only one person. And maybe you could say, well, that's a very extreme case, or it's a very deviant case, or something like that. But it does tell you something about the system. It means that in our maternal and child health system in Arizona, it is possible for a mother to reach a state where she thinks she's going to, where she feels she's at risk of maternal death. So if you're trying to understand, for example, why maternal deaths in the US are very high for an advanced industrialized country, that kind of interview can be very instructive. She actually made a statement. Now I understand why maternal deaths in the US are so high, because there I was in a rural hospital, and I was abandoned when I needed care. So that's just an encouragement that the way we present our data and how we use it and the claims we make about it can render it extremely useful in terms of understanding how systems work, how social systems work, or how medical systems work. That may be very instructive for policy, or again, depending on what you're trying to achieve. And again, in terms of conceptual generalization, what do we mean by that? Let's go back to our discourse analysis and the focus that I suggested on the concept of giving up. So we might be able to make a generalization about the idea of giving up in US culture that would go beyond the study. And then we can test that in other settings and say, well, that's really interesting. Now we're doing research with students. I wonder if their concept of giving up is similar. So you can then test it. So now, finally, I think this is my final slide, is Miles and Huberman said that conclusions and verification are your final stage. And so we mustn't forget the verification. How do you verify your conclusions? As you're doing your coding and your analysis, you should always go check back to the data. That's the most basic way. Is, you start thinking that you're coming to a conclusion, then you sort of think, well, let's go back to the data. How many cases were there? Maybe you do a table that shows some kind of numeric representation of how often did this theme come up. And that would be your first level of verification. Now, these three are second level verification, and one of them is it is strongly encouraged to use multiple coders when you're coding your data. And then that means that then you can do an intercoder agreement. And if all the coders are coding the same way, then that is an important form of verification. It makes your conclusions much stronger if several team members independently come to the same conclusions. The second way is triangulation, meaning that you're using mixed methods. For example, in maternal and child health study, we use focus groups and we used interviews. And then you can compare the results from the focus groups and the interviews. You can also use observation. I worked on formative research in Indonesia for the USAID funded IU Wash Plus project. That is a water sanitation and hygiene project. And we did a survey, focus groups, and household observations. So we were able to see if you got a finding that was reinforced across all of those methods, it makes your finding much stronger. And the third form of verification is from the literature. You should be able to say in your journal article, in the discussion section, how do your conclusions relate to the literature? If they are confirmed by the literature, that's one form of verification. If there's a difference, you need to go back to the data, you need to go back to the theory, back to the literature to maybe come up with some kind of statement why you think there might be a deviation from your findings from what's in the literature. So it's just a question of exploring, depending on the study, which forms of verification are important. And again, this goes back to your audit trail and recording what you do and including that in your method section. So that is all that I had to say today. Thank you very much for your attention, and I hope that that has been helpful.